Welcome to In the Know Medical Imaging, where we make medical imaging easy to understand. For couples navigating infertility, evaluating the shape of the uterus and checking if the fallopian tubes are open is one of the most critical diagnostic steps. How do we test tubal patency in real time? Today, we are exploring hysterosalpingography. We will explain what patients experience during an HSG while breaking down contrast selection, uterine spasm management, and fluoroscopic dose control for our technologist community. For patients experiencing difficulty conceiving, a hysterosalpingography, or HSG, provides a live X-ray video of your reproductive anatomy. It checks whether your fallopian tubes are open and evaluates the internal shape of your uterus for fibroids or polyps. Interestingly, the gentle flushing of contrast liquid during the exam can sometimes clear out minor mucus plugs, slightly increasing pregnancy rates in the months immediately following the test. Timing is everything when scheduling an HSG. The exam is booked between days 7 and 10 of your menstrual cycle, right after your period ends but before ovulation. This timing ensures you aren't pregnant and keeps the uterine lining thin for clear images. Taking an over-the-counter pain reliever like ibuprofen 1 hour before the appointment helps manage temporary menstrual-like cramping while contrast is gently introduced. For our technologist community, strict adherence to the early follicular phase window is a crucial safety rule. Scheduling post-menses prevents accidental radiation exposure to an undetected early pregnancy and ensures a thin endometrial lining. It also avoids flushing shed menstrual debris through the fallopian tubes into the peritoneal cavity, reducing the risk of iatrogenic endometriosis or pelvic infection. Technologists must understand the clinical differences between water-soluble and oil-soluble contrast media. Water-soluble iodinated contrast provides rapid peritoneal absorption, excellent mucosal detail, and lower risk of pelvic granulomas. Oil-soluble media offers higher radiological density and has been associated with higher post-procedure pregnancy rates, but requires careful injection pressure monitoring to avoid intravasation risks. Modern HSG procedures predominantly utilize flexible balloon catheters placed within the cervical canal. Inflating the balloon with 1 to 2 milliliters of sterile water creates an airtight seal at the internal OS, preventing contrast reflux into the vagina. Technologists should ensure air bubbles are meticulously purged from the catheter line prior to insertion to avoid false positive filling defects. Capturing images at specific filling phases ensures comprehensive diagnostic evaluation. Technologists capture an early filling view to identify small endometrial polyps or fibroids before dense contrast obscures them. Subsequent spot images document full uterine cavity distension, contrast filling of the fallopian tubes, and free peritoneal spillage surrounding the ovaries to confirm tubal patency. Differentiating physiological muscle spasms from true tubal occlusion is a key diagnostic challenge. Transmyometrial pressure or patient anxiety can cause transient constriction of the smooth muscle at the uterotubal junction, mimicking tubal blockage. Keeping contrast injections slow and steady, allowing the patient to relax, or acquiring delayed spot images helps confirm true patency. Technologists must recognize procedural complications like vascular intravasation. If contrast enters the myometrial venous plexus due to high injection pressure or mucosal trauma, the procedure should be paused. To maintain radiation safety, technologists should utilize low frame rate pulsed fluoroscopy and tight collimation to protect the ovaries. Hysterosalpingography combines real-time fluoroscopy and careful contrast technique to evaluate reproductive health and guide fertility care. Thanks for watching. If you learned something today, make sure to like, comment, and subscribe, and check out our merch store for more cool medical imaging items.